Welcome to the recorded version of Healthy Nutrition for Older Patients, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Homestead Senior Care.
Okay, our presenter today is Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Homestead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. She is a doctoral candidate at the University of Nebraska-Omaha, where she is studying social gerontology. Lakeland has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. And with that, I'm going to turn the floor over to Lakeland Hogan, our presenter this month and every month. Welcome, Lakeland.
Hi, thanks so much, Steve. Hello, everyone. Thank you so much for joining this webinar today. We're going to be talking about health and nutrition for older patients. Nutrition is an important topic for people of all ages, of course, but it's especially important for the older adults that we work with. The impacts of the aging process can result in physical and social factors that can influence the nutrition or lack thereof for older adults. And if you think about it, food is a big part of our everyday lives. We eat multiple times a day, and our bodies need those important nutrients. We find that for older adults, it is their family caregivers that are helping in some way to provide for the nutritional needs of their loved one. About 83% of family caregivers help with groceries or other errands, and 65% of family caregivers assist with meal preparation. So again, they play an important role. And as professionals working with older patients and their family caregivers, it's important for us to communicate the importance of nutrition, hydration, and daily activity. And we also have the opportunity to connect families with resources. So today we're going to go into more depth on this topic, and we're going to cover the following objectives. During this webinar, we're going to discuss why proper nutrition is so important for older patients. We will go over the physical and social components that can cause poor nutrition and talk about some of the warning signs to look for when nutrition is lacking. Then we'll talk about the nutritional guidelines for older patients and offer up tips to help family caregivers with their role in helping their loved ones maintain proper nutrition. I will also touch on the social component of mealtime and the importance that companionship has in the mealtime and preparation. Finally, we're going to talk about ways to manage dietary concerns. There's a few specific chronic illnesses that can have additional impacts on nutrition, such as Alzheimer's disease and diabetes. But before we get started, I do want to recognize an expert in the field of nutrition, Shannon Muse, who's a registered dietitian, and in preparing for today's webinar, she helped to provide me with some wonderful resources that I really look forward to sharing with you all today. So first, we're going to start with some of the physical factors that can impact nutrition. And as you can see, there are many of them. When you consider the aging process, older patients are more likely to develop chronic diseases or chronic illness. As we age, our bodies and internal systems slow and change. Illnesses can pop up that require a modification in what we can and can't eat. Energy levels may not be what they used to be for older patients, and their metabolism has likely slowed down. When older adults have a chronic illness, such as arthritis, they can have continual pain, and it may affect their ability to shop and prepare foods. Chronic illness may also suppress appetite, even though these illnesses really do require more nutrients for the body. Another physical factor to consider involves chewing and swallowing. Some people fail to realize that dental health can play an important role in nutrition. If an older patient is experiencing dental issues, such as poorly fitted dentures, cavities, or gum problems, it can really affect their ability to chew and could limit the types of food that they can take in. Dry mouth is also something to consider. It's a common side effect of some medications and certain chronic conditions or diseases, such as Parkinson's. And even if an older adult is taking in nutrients, they may have issues with absorption of those nutrients. The production of certain digestive enzymes and acids diminish as we age, which makes it harder for the body to break down protein and absorb key vitamins, such as B12, folate, and sometimes calcium and iron. And when the body can't absorb these crucial vitamins, and it can impact various body systems within our body. And I mentioned this briefly, but medications can also impact nutrition. Some meds can suppress appetite, alter the way food tastes, and in some cases even cause nausea or vomiting. The research varies on the number of meds that are taken daily by older adults, but it can really vary anywhere from 2 to 20 medications per day. And the more medications an older adult is taking, the more that they're at risk of noncompliance and adverse drug interactions, both of which could impact their appetite and nutrition. So it's important for caregivers to be mindful of this factor that could influence their nutrition. Older adults are also likely to experience hospitalization at various points in later life due to a variety of reasons. A hospital stay can cause trauma or stress, which could lead to a loss of appetite and weakness. After a hospital stay, an older adult might not be feeling up to cooking or going to the grocery store, but it's a really important time for them to get those proper nutrients, as it helps to aid in the recovery process. And if they're not getting enough nutrients, it could actually prolong the recovery period. And in some extreme cases, it could lead to rehospitalization, especially if dehydration is a factor. And as we get older, it is a part of normal aging to experience some sensory loss. And of course, two important senses when it comes to nutrition is our sense of taste and our sense of smell. Being able to taste our food and smell the delicious smells is a large part of the comfort and enjoyment of food. Just to give you kind of a quick example, my grandma, she's an amazing cook. I've grown up eating her food and always look forward to a meal she prepares. But recently, my grandpa made a comment about how his taste and smell has kind of faded, so her food doesn't taste as good to him these days. And you should have seen my grandma's face. She was white as a ghost. It was probably the most shocking and offensive thing he could have ever said to her. People take food very personally in my family. But it just goes to show that this way your food tastes and smells really impacts how you enjoy it. And I can tell you, I'm sure my grandma is now adding extra flavor to their meals, extra spices, to make sure grandpa's enjoying every bite. But another impact is medications. They can alter the way sometimes that we taste and smell food. So again, something for caregivers to keep in mind. And finally, it's common to see lower activity levels in older adults, especially in those that have experienced limitation in their mobility. If there's a lack of activity, it could cause a loss of muscle and fat, which could also decrease an older adult's appetite due to changes in that person's body chemistry. Not eating enough or not eating the right things could also decrease a person's energy. And when we're moving about and exercising, being physically active, we're burning energy and calories. And as a result, we get hungry and we need nutrients to sustain us. So when an older adult has a lower activity level, they're not burning as many calories and they're not having some of those same hunger sensations, or they might not have a need for as many calories. But that does not make nutrition any less important. And in fact, because they may be taking on a smaller amount of food than they once were, it makes nutrition that much more important, because we want to make sure that in that reduced amount of food they're taking in, they're getting as many nutrients as possible. So in addition to these physical factors, there are also some social factors. Social aspects may be easily overlooked when it comes to nutrition, but there are certainly some factors that need to be considered. And while depression is not a normal part of aging, it can certainly impact the way we take in food. There are many reasons why older adults might be feeling low or depressed. It could be due to grief or loneliness. It could also be due to a recent illness or a limitation in their mobility. Depression and mood changes can certainly have an effect on our nutrition. I don't know about you, but sometimes I can be an emotional eater. I hate to admit it, but sometimes when a person is feeling depressed or low, they might overeat or seek out high-calorie comfort foods, or they might lose their appetite altogether or fail to take in proper nutrients. Another social factor to consider is income. Many older adults are on fixed incomes, and this might limit their food budget, which could cause them to choose lower-cost food options. Unfortunately, those lower-cost options may not be the healthiest options. And in some extreme cases of limited income, their incomes are so limited that they might need to choose between food and other vital supplies, such as medication. Or they might leave a prescription unfilled so they can purchase food, which can lead to a whole host of other problems beyond just their nutrition. So certainly something to keep in mind. And then we've talked briefly about the changes that the body goes through as a person gets older. And with that can come chronic conditions, many of which require dietary restrictions. And you might not consider this to be a social factor, but if you think about it, having to change your diet, a diet that you've been used to consuming your whole life, can bring up some social issues, especially in cases where they're at social events and they aren't allowed to eat the cake at the birthday party or the ice cream. So it might cause them to refrain from attending those social events or restrict their ability to go out to eat. And then finally, a social component to consider is companionship and socialization during mealtime. And I don't know about you, but when I eat alone, I'm more likely to grab something quick, which is not always a healthy choice. But when I'm eating with someone else, I put more time and energy into making the meal and actually takes time to sit down and enjoy it instead of eating on the go. And I've seen similar patterns in the older adults I've worked with over the years. If they're eating alone, they're more likely to heat up a frozen dinner or a can of soup, which might not be the best option. Or they may even skip the meal altogether. But if they're eating with someone else, or if someone else prepares them a meal, they're more likely to enjoy the mealtime. So we're going to dive a little bit deeper into the different risks associated with isolation and lack of companionship at mealtime, and we'll touch on that a little bit later in today's presentation. But now we know the physical and social factors of nutrition, but I want to share some warning signs that we can educate families on to look for in their older adult loved one. Family caregivers, friends, and neighbors can play a really important role in catching these warning signs early and assisting the older adult in improving their nutrition. So it's important for us as professionals, again, to educate these caregivers on 7 warning signs. The first is a loss of appetite. If an older adult has always been a hearty eater but no longer eats as he or she used to, it's really time to find out why. It could be an underlying illness, problems with ill-fitting dentures, or pain while chewing. And it's important to visit with the person if you notice these changes and even schedule a visit to a medical professional if needed. Also, changes in mood can be a sign that something is not quite right. Depression, again, is a common sign of poor nutrition. And as we said before, feelings of depression can cause a person not to eat or overeat. And if a person seems to kind of be out of it or exhibiting flighty or spacey behavior, it could be a sign that they're not getting proper nutrition or a sign that they're dehydrated. Another warning sign would be a sudden fluctuation in weight. A weight change, either losing or gaining about 10 pounds in a 6-month time frame, could be a warning sign of poor nutrition in an older adult, unless they're actively trying to lose weight, of course, or gain weight. But it might be hard to spot a weight loss or gain, but families can look for clues in their clothing choices, and they can also keep an eye on how much spoiled food is being thrown away or left over at the end of each week. Skin tone is one warning sign to look out for that people might not consider. When an older adult is eating properly and they're well hydrated, their skin should look healthy, but if they are dehydrated or they're lacking nutrition, their skin might appear ashy or dull and might be really dry. Cognitive issues or a change in cognition is something to look out for. Dementia and cognitive problems can cause a person to forget to eat or could cause overeating if they've forgotten that they just ate. And For some types of cognitive impairment, they might have impaired judgment, which could lead to overeating of sweets, junk food, and possibly even eating spoiled foods. So again, something to keep an eye out for. And we've already talked about medication as something that can influence nutrition, but something important for caregivers to pay attention to is changes in appetite, nutrition, and weight when an older adult starts a new medication or discontinues a medication. If there's any sort of change, the medication might be the cause, and the pharmacists and physicians should be consulted. And it's a good practice to just have an older adult's medications reviewed regularly, just to make sure that there's not any negative impacts happening. And one final warning sign to look for is lethargy. We talked about how illness and hospital stays can impact nutrition. They can also cause lethargy in older adults. If a person's feeling tired or lethargic, it's tough to get motivated to make a meal or get out to go to the grocery store. It's important that the older adult has proper support after a hospital stay or illness, just to monitor their recovery and make sure that they're eating and hydrating properly. Another cause of lethargy could be muscle weakness or even anemia caused by poor nutrition. So if the person is more tired and sleeping more than usual, if they're experiencing frequent falls or more weakness getting up out of a chair or out of bed, this could be a sign that they're not getting proper nutrition needed. It could be a sign of something else that's going on, so it's important to make sure that they visit a medical professional. And I know it's great to know all of these warning signs, but it's also important that we communicate to caregivers what they should do if they identify one of these warning signs. It's important to start by having a conversation with the older adult. If we really listen and aim to gain an understanding about what's going on in the older adult's life that could be contributing to poor eating habits, we're much more likely to help generate solutions that can resolve the situation. It can also help us work with the older adult to involve them in coming up with those solutions. And as we know, older adults might be reluctant to talk openly about issues and challenges they're experiencing. They might be embarrassed. They might not want to admit that they need help. And they also might feel that this issue is really not that big of a deal. So we need to be aware and sensitive of this. But older adults and their families may be able to talk through some solutions together, and the older adult might be surprised to learn that some of their health issues they're experiencing could be a result of poor nutrition, and some simple dietary changes can make a big difference. And other more serious issues may, again, need the consulting of a medical professional. The family might also want to visit with a registered dietitian. These nutrition professionals can help with meal planning. They can help identify foods that can help with poor nutrition. And if the older adult does have dietary restrictions, a registered dietitian can help them navigate those new restrictions. So you can ask the physician for a recommendation, or in many areas of the country, the local grocery store has dietitians on staff these days that you can consult with. And finally, if there is a problem within the mouth, maybe a dental or jaw problem, we certainly want to make sure that the older adult is visiting the dentist not only regularly, but especially when these issues come up. So let's talk through the nutritional guidelines. We've been talking a lot about what nutrition is so important for older adults. And while some of these nutritional guidelines might look familiar to you, they are common for people of all ages. They are really important for older adults specifically. And while many older adults take supplements and vitamins, it does not mean that they can skip out on key nutrients that we get from nutrient-rich foods. And some of the best nutrients come to us through fruits and vegetables. Fruits and vegetables are full of necessary vitamin and minerals. Each color provides unique nutrients, so a variety of fruits and vegetables throughout the week is key. Even though fresh is best, frozen is also a good option, and canned fruits and vegetables are better than none at all. So we want to make sure if they are getting canned fruits and veggies, that the fruits don't have any added sugars and that the veggies are limited in their salt content. Protein intake is also really important to avoid muscle loss and nutritional deficiencies. And we want to aim for a variety of protein in the weekly meal plan. tuna and salmon are especially good because they have high omega-3 fatty acids, giving positive benefits towards heart health and brain health. Other good protein choices are lean meats such as beef, pork, chicken, and turkey. And it's also important to try some plant sources of protein, such as beans, lentils, and edamame or soybeans. And for those adults recovering from illness or surgery, lean proteins are especially important and helpful in aiding in recovery. And sometimes carbs get a bad reputation, but if we're going to take them in, we want to stick to those whole grain breads, pastas, rice, cereals, and snacks. Whole grains are higher in fiber and nutrients. And then if we can limit those refined grains or those white grains as much as possible, it's to the benefit of the older adult. And finally, milk and dairy foods provide the right amount of bone-building nutrients, specifically calcium, vitamin D, protein, phosphorus, magnesium, potassium, vitamin B12, and zinc. So for those that are lactose intolerant, there are a lot of great lactose-free options out there, such as milk and yogurt, and oftentimes you can find them in the health section or in some supermarkets right next to the regular milk. So there's some additional nutritional guidelines. Fat, another food that sometimes gets a bad rap, but something we don't need to avoid fats, but we do need to educate older adults on the good fats versus the bad fats. The fat from olive oil, avocados, and salmon, for example, can protect the body against heart disease by controlling the bad LDL cholesterol levels and raising the good HDL cholesterol levels. And an easy tip to tell older adults is to switch from solid fats, such as butter or margarine, to more liquid fats, such as oils, like olive oil, when preparing food. We also want to encourage older adults to limit sweets and sugary drinks, especially if the older adult is overweight or has chronic conditions such as diabetes. And fruit and yogurt are two healthier ways to satisfy that sweet tooth while giving us important nutrients. And sodium, we hear a lot about how older adults should restrict sodium, especially if they have certain chronic conditions. Limiting sodium can prevent water retention, and that's especially important for some medical conditions. And finally, fiber can aid in keeping an older adult's digestion regular and help with constipation, which we know can be a common issue. It's good to get about 20 to 30 grams of fiber per day if you're an older adult, and some nutrient-rich options for fiber are listed there on your screen. But it's important to note that when you are taking in a lot of fiber, you should also increase your fluid intake because it helps aid in the digestion and keep everything working. And the next nutritional guideline actually has nothing to do with food at all, but it is important in maintaining a healthy lifestyle, and that is physical activity. Participating in regular physical activity, as we discussed earlier, can help to stimulate appetite and help to maintain muscle mass and strength. It's recommended that older adults get about 30 minutes of physical activity 3 days a week. And of course, consulting a medical professional before starting an activity is important, especially if the older adult is not currently active. It's also important to discuss with a clinician to see if additional supplements and vitamins are needed for specific health needs. And finally, we want to ensure that older adults are getting plenty of fluid throughout the day. And I think that hydration is so important that I wanted to give it its own slide. Dehydration has been associated with many elderly health issues, including confusion, impaired cognition, falls, and constipation. It's important to encourage older adults not to wait until they're thirsty to drink. And sometimes it's helpful to think of drinking water as a prescription. Think of it as, I have to drink 8 ounces of water with my morning pills. It's a great way for everyone to start the day, really. And Dr. Connie Bales at the Duke University Medical Center recommends that older adults drink about 6 glasses of water a day, especially those in warmer climates. Another tip is to encourage a full glass of liquid at each meal and snack. Keeping water close at all times can be especially helpful. Maybe there's a special bottle that's easy to use and carry, or if older adults find larger glasses to be more intimidating, you might use a smaller glass like a juice glass or Dixie cup and refill it frequently. I worked with a woman named Ethel for several years, one of my favorite clients of all time, and several times a day she lined up her shot glasses full of water, and she'd take them one right after another, and she would joke about how many shots she took every day. Of course, they were water. So you can make hydration fun if you want to. I know it's hard to believe, but hydration can be fun. And you can enhance your water with splashes of juice, cucumber slices, and even fresh herbs. Sometimes sparkling water can be a good substitute as well. Eating water-based fruits and vegetables can also be helpful and get you those needed nutrients. Watermelon and cucumbers have more water content compared to some other fruits and veggies. Unsweetened tea and coffee can contribute to fluid intake. Some may think that caffeine leads to dehydration, but we actually know that it doesn't necessarily dehydrate the body, even though it can cause more frequent urination. So trying to limit the amount that's taken in each day is a good idea. Milk can also be hydrating and full of nutrients, same as 100% juice. And oftentimes, when we're working with older adults, there's incontinence issues at hand, and sometimes that can prevent an older adult from taking in fluids because they might not, or they might have a fear of not being able to get to the restroom on time, or they just have some insecurities about going to the restroom. But dehydration can lead to other urinary issues such as UTIs. So drinking lots of fluids is still so important. Older adults can integrate regular bathroom breaks into their routine, and also if they're worried about getting up in the middle of the night to use the restroom, the older adult could try to drink as much of the fluids that they can in the earlier part of the day to avoid those middle of the night restroom breaks. And finally, it's important to avoid sweetened soft drinks and sports drinks. They can be filled with lots of sugar and empty calories, but they could replace them with one of the other healthier options that I've just mentioned. And knowing the guidelines is important, but preparing and cooking the meals for some can be intimidating, so I wanted to provide a few tips on cooking. So the first is to make mealtime fun. Obviously, having all of this good food doesn't do an older adult any good if they're not enjoying cooking it or enjoying eating it. A nutrition expert at the University of Maryland suggests that making mealtime a happy event can go a long way in making sure that the older adult has proper nutrition. Sometimes we focus too much on what we can't eat and don't give enough attention to what we can eat and what food can do for us. It's about the aromas, the colors, feels, textures, socializing, and that's what makes mealtime so enjoyable. Another tip that I just mentioned, but I'll mention it again because I think it's really important, is to avoid empty calories. These are foods that come from solid fats and they have added sugars and really no nutritional value. These are things like sodas, sweets, and chips, those packaged foods that you see in the middle aisles of the grocery store. Soups can be a really great option for older adults, especially during cold months or for those that have some of those mouth, gum, dental issues that we've been talking about. They're easy to prepare, they provide great leftovers, and they can help with hydration. We just need to be sure that older adults are watching the sodium content that goes into soups. Sometimes it can get a little out of control if we're not careful. It's also important to mix up meals. Sometimes it's easy to get stuck in a rut of eating the same thing at the same time every day. So older adults could consider switching breakfast foods for dinner or having a tuna sandwich in the morning. So the goal is variety of health foods, and it really doesn't matter what time of day that they're eaten. And we know that variety is the spice of life, and that's really true when it comes to our food. So planning and preparing a variety of foods can help older adults stay interested in eating. For example, if a food tastes too bland, we can suggest some natural flavor enhancers which are also good for them. Maybe olive oils, vinegars, garlic, onions, lemons, limes, spices. Spices are also good for those who are trying to cut back on salt. They can be a nice substitute. And a variety of foods within a variety of food groups can also help an older adult get those nutritional needs met. Another great idea to help improve an older adult's nutrition and save them money is to prepare healthy snacks at home. You can put them together in small baggies or small Tupperwares using foods such as nuts, seeds, low-fat cheeses, fresh veggies and fruits, and they can do this rather than buying less healthy and more expensive pre-packaged and processed snacks. They can also do some batch cooking when the food budget and time allows. This can also help save money in the long run. So for example, they could cook a large amount of spaghetti sauce and divide it into small portions. They could freeze some to use later in the month, but be sure that they're labeling all fresh and frozen foods with an expiration date. Another idea is to take advantage of planned leftovers, which can cut down preparation time and, again, save on food dollars. So, for example, if you prepare a roast, you could have half of it that night for dinner, and then tomorrow make a stew with it or make it later in the week. So as you can see, planning and organizing can be key to good nutritional habits. And one big important part of getting all of these foods is taking a trip to the grocery store. So I do have some tips for grocery store shopping. As basic as it may sound, some people don't know how to make trips to the grocery store more organized and productive. And of course, this is especially true if an older adult has never done the grocery shopping or meal planning in their household. I've worked with several older gentlemen whose wives have passed away, or perhaps they've developed Alzheimer's disease and they can no longer prepare meals. And so the husband is now in the grocery shopping, the meal preparation for the first time really in their lives, and they can benefit from a little direction. So here are some easy tips that you can share. Again, these are basic, but if you put yourself in the shoes of these older gentlemen maybe who have never shopped before, these tips can go a long way. First is pretty easy. Make a list. You can figure out what you're going to eat for the week. It can help cut down on the money spent and the time spent and those last-minute purchases, pulling things off the shelf that are maybe less healthy. And then you probably heard this one before, but don't shop hungry. It can lead to, again, those tempting purchases of chips or salty snacks. You can review store ads to clip coupons. You can sign up for a grocery store's bonus card or rewards card. And also, you can ask the grocery store if they have any senior citizen discounts. I know my local grocery store on Wednesdays, 10% off for anyone over 65. So another perk of being an older adult and shopping at a grocery store. Also, shopping the perimeter of the store is important because that's where the fresh and healthy foods are located. Again, those inner aisles have more of the prepared and processed foods. Also, educate them on store brands. Oftentimes, they're cheaper and just as good as the brand names. And finally, encourage them to try new foods. Sometimes the grocery store will label kind of unusual foods and how to prepare them, or try a new recipe with some foods that they've never tried before. And after sharing these suggestions, you might also want to recommend that as they're grocery shopping, that they stock up on a few staples. Having healthy staples on hand can always be a good idea. Having fruits on hand can provide a great snack. They can make for a yummy smoothie or a side dish for a meal. And especially during months of extreme weather, maybe the colder months, having a lot of staples on hand can be really important for an older adult, especially if a snowstorm comes in, they can't get out, or in those extremely hot months of the year where being outside for an older adult might be hazardous to their health. It's also important to have some vegetables on hand. And again, frozen, fresh, and canned are all good options. When it comes to vegetables, the more vibrant the colors, the more likely they are to have nutrients, especially those green veggies. And it can be tempting to cover them in cheesy sauces or buy those frozen packets that come with sauces, but older adults should be aware of the calories or the sodium content, and sometimes just adding a little butter or olive oil and some spices can make the veggies taste just as good. And of course, we've talked about protein, and having protein on hand is really important. All lean meats can really fit into a healthy meal plan for older adults. And we can encourage older adults to have protein with each meal, and if there is a concern that they're not getting enough protein, we can even encourage protein at snack times as well. Cooking proteins in a crock pot is a really easy way for older adults to prepare a meal, and you can even throw some of those vibrant colored veggies in towards the end. And eggs are another easy protein that can be prepared a variety of ways. So again, all those types of protein on the screen, meat and non-meat proteins, are good to have on hand, whether they're in the freezer, fresh, or some of them even can come canned. Next, of course, is dairy. Who doesn't love a little dairy in their life? If an older adult is not lactose intolerant, they can have up to 3 servings a day. That's a nutritional guideline for older adults. Milk, we know, is full of great nutrients. And Greek yogurt is a great option, especially for protein. Yogurt also has valuable probiotics for good gut health. And who doesn't love a little cheese every now and then? And then finally, having grains on hand. It's really easy to have grains on hand as a staple. Again, the whole grains are better for us than the refined, especially for older adults, because they can increase their fiber content. And many options in the supermarket today, you can buy bulk in these types of grain items, and it can really help cut down on costs. And if you're concerned about the bread or tortillas going bad, you can always freeze them in smaller portions and thaw them out or toast them as needed. When we're thinking about older adults, a lot of times there's concern around, well, I don't want to buy too much because I'm only one person or we're just 2 people. We don't want it to go bad. The freezer is your best friend. The key there is just labeling all the foods so you know when they expire. And eating the right foods can be important, but if you are living alone, you might be at more nutritional risk than those who do not live at home. So I want to dive a little bit deeper into that. We know that living alone can put older adults at risk for social isolation, and social isolation has many implications, including nutritional risks. Social isolation may lead to eating alone, which can cause a person to eat less regular meals, use convenient foods more often, and reduce the variety of foods eaten. And I also wanted to share the results of a study called The Meaning of Mealtime, Social and Nutritional Needs Identified Among Older Adults Attending Day Services and by Healthcare Professionals. It's a very long title, but it's found in the the International Journal of Geriatric Psychiatry. So in this study, it involved volunteers that were sent into the homes of older adults about once a week to prepare and eat nutritious meals together. So the study used 100 people over the age of 60, and the participants had no major memory issues. The older adults participating were divided into 2 groups, and both groups received a nutritional guidebook and manual, but only the intervention group received the volunteer visits. The results showed that the intervention group, who had visits from volunteers, increased their food enjoyment. Self-efficacy improved in both groups in the study, but it was strongest in the intervention group. The participants also enjoyed the experience and reported looking forward to the visits from the volunteers. Food enjoyment was linked to nutritional status, and this intervention led to increased food enjoyment. So this particular study, the evidence gives further support that incorporating regular socialization during meals, even just once a week, can really make a big impact in food enjoyment, in the nutritional status of the older adult. So when we talk about individuals living alone, if we can integrate some sort of socialization at least once a week into one of the meal times, it can go a long way. So let's talk a little more about the social component. And preparing a meal doesn't just have to be a task for an older adult. It really can create a social environment, as we've been talking about. And the various socialization activities can be the shopping, going to the grocery store with someone, preparing and cooking a meal together, or going out for a meal and sharing it together. So when you are working with older adults and suggest adding social supports to these activities, it might be during those various stages, the grocery shopping or the preparation or just sharing the meal together. Social interaction and conversation during mealtime also provides opportunity to cognitively stimulate the brain. Conversations require attention, memory, organizing thoughts, as well as controlling our language ability. So all of these activities are stimulating the brain. So not only are we getting enjoyment of the people around us when older adults are eating, they're also actively using their brain, which can be so important. So what are some ways that older adults can get help with meals and socialization? And I recognize that not all older adults have family that lives close by. So if that's the case and the older adult can't go to the grocery store or shop alone, there are a number of possibilities depending on their living situation, finances, and needs. First, many grocery stores today have a delivery system or a delivery service, so you can order the groceries on the internet or call in your order. And then they will be delivered right to the door. So again, a great option for somebody who can't get out and about. Another option is to suggest that they are a family member, a friend, a neighbor, a college student. See if any of them would be willing to do the shopping in exchange for sharing a meal together. And this solves two needs of the older adult at once, buying the groceries and then providing dining companionship for your senior loved one or your neighbor. And again, as with many issues that older adults face, generating a creative solution can really go a long way. So whether it's utilizing a family member, again, a neighbor, friend, or professional service such as home care, it can really go a long way in meeting the need of the older adult. There are also community-based programs such as Meals on Wheels, and this provides a nutritional meal option for those that might be homebound, disabled, or that would otherwise be unable to maintain their dietary needs. And these programs can be a godsend for many people. And in an effort to both cover costs and maintain the older person's dignity, the programs sometimes do charge a small fee based on the individual's ability to pay. And then if it's companionship that would make meals more enjoyable for the older adult, there are a number of options to consider. First, they can contact their local senior center, local YMCA, their faith-based congregation, and see if there is a senior meal program available. And then you can also encourage families, friends, acquaintances to share potlucks, lunches, or dinners on a rotating basis. Even if it's just a quick coffee and breakfast, it can really, again, go a long way in providing for that social need for the older adult. And then, in addition to all of these great options, I wanted to mention one more option, the meal programs such as Blue Apron or Fresh Time or those types of mail order meal services can be an option for some people. However, they do require some preparation still. But there are also other meal delivery programs that will ship prepared meals right to the front door of the older adult. And as I was at ASA, the big conference in San Francisco last week, I was walking through the exhibit hall and just saw a couple that I thought I would mention. Silver Cuisine is one option, and Mom's Meals is another option. And again, they can deliver meals through the mail right to the front door. So again, it can be a nice option for an older adult that might not have the time or the ability, to get out to the grocery store or the ability to prepare meals. All right, so we know some tips on how to help older adults get additional help if needed, but for some, they might have specific chronic conditions that would limit their diets. So I wanted to start with those conditions by talking about diabetes. And I know I've already mentioned diabetes a couple times throughout the webinar, but according to the American Diabetes Association, more than 18% or 8.6 million Americans age 65 and older have diabetes. So the prevalence of diabetes increases with age, and the risk of developing type 2 diabetes also increases with age. So it's likely that you will be interacting with older adults that have diabetes. And this can create some, dietary challenges. We know that diabetes causes a decline in insulin production and an increase in glucose intolerance. So oftentimes when an older adult is diagnosed with diabetes, they're given a list of dietary restrictions, mainly in the area of carbohydrates, high sugar, those types of foods. So people with diabetes need to focus on foods that are high in fiber and nutrient dense. This includes plant foods, most dairy products, lean meats, poultry, and fish. Conversely, diabetics need to keep highly processed foods, which are often full of those empty nutrients, to a minimum. So the internet is full of lots of helpful information for seniors on diabetes nutrition. The Diabetes Association has a great guide for those who are 55 plus. And some of their recommendations are: start each meal with a salad or broth-based soup. Choose veggies and fruits as a side instead of French fries. And avoid buffets, and instead of eating a whole dessert by yourself, to share a dessert with someone else. So the good news is that the best diet for a person with diabetes is really the same kind of healthy eating that's best for everyone, but they just might have to alter their diet a little more. And registered dietitians can be a great resource for older adults that have had a recent diabetes diagnosis to help explain which foods they should avoid and which foods to integrate into their diet. Another disease that is important to consider when thinking through the nutritional impacts on older adults is Alzheimer's disease, or another form of cognitive impairment, another form of dementia. Eating and drinking habits may change when a person has dementia. We must encourage the family to stick to a routine to ensure the success. So for example, when it comes to mealtime, making sure breakfast is at the same time each day, and sometimes for those with dementia, having familiar or comforting foods can be important. And getting them to take in enough liquids can sometimes be difficult for someone, especially as the disease progresses, and swallowing might be a problem, or the use of appliances might be a concern, so they might have to stop cooking for themselves because of the decline in their cognition. So when these changes occur, we want to make sure that the family puts a plan into place to ensure that the person is continuing to get the nutrition that they need, even though the disease continues to progress and their needs change. So here are a few tips. Especially as the person enters into some of the later stages of dementia, finger-friendly foods are a way to modify or simplify a meal, but they can go a long way in making sure that they're still getting those needed nutrients. Setting a simple table can also be a way to encourage eating. We want to avoid patterned plates or dishes, and sometimes placemats or tablecloths can be confusing. So the simpler the table setting, the better it can be for the individual. And then serving just one dish or food at a time can be helpful. Sometimes if there are multiple items on the plate, it can be maybe confusing. So if you're finding that the older adult is having some confusion at mealtime, perhaps serving one dish at a time can be a good approach to try. And then having contrasts on the dinner plate. If there's a white plate with turkey, potatoes, and cauliflower, the depth perception for some forms of dementia can deteriorate over time, so they might have, again, some confusion. So creating a colorful contrast on the plate can be helpful. And then if the person doesn't recognize what they're eating, or they're not quite sure how to eat the food, sometimes that part of the memory goes away as the person progresses in the disease. Sometimes explaining to them, or step-by-step showing them, pick up your fork, okay, pick up a piece of food, all right, now bring it to the mouth, or modeling it, showing them, eat alongside them, show them how to eat. It might trigger that activity in the brain. And then it's important to know the person's routines and food preferences. Sometimes keeping a journal of foods that they really like can be helpful. There's also adaptive tableware. For instance, maybe using a bowl instead of a plate to help them scoop up the food easier, or cups with lids, or straws to ensure fewer spills. For people, I know some may have a Parkinson's-related dementia, but people with Parkinson's sometimes have a shaky hand, and there's a lot of great modifications to silverware now that are available. All right, so I've gone through a couple of chronic conditions that might impact a person's nutritional intake, and I want to leave you finally with some recommended resources. Again, a registered dietitian, preferably one who is certified as a diabetes educator, can be a really great resource for individuals who are needing some assistance with adapting to the new dietary restrictions after a diabetes diagnosis, and they can also help provide a more individualized meal plan. There's also a whole host of websites. The National Institute for Health, the USDA, they both have some great nutritional guidelines for older adults, some great kind of guidebooks that you can download online. N4A.org, that's the National Area Agencies on Aging. A lot of those organizations have a Meals on Wheels program, so you can visit those sites, type in your zip code, and find the closest location to you. Also, mealsonwheels.org is another great resource. They can help you locate a meals program close to you. And then the Academy of Nutrition and Dietetics, you can go there for some great resources. And then if you were looking to learn more about companionship at mealtime, you can go to cravingcompanionship.com. And then Food for Seniors and Sunday Dinner Pledge, again, all great resources for older adults if you're looking to improve their nutrition. So with that, I'm going to open it up for questions. And you will see that Lanita's on the slide. Unfortunately, she had something come up and will not be joining us, but I am happy to take any questions that you might have. So Steve, I'll pass it back to you for questions.
Okay, great. Thank you very much, Lakeland. Yes, everyone, it is time for the Q&A portion. So please send in those questions for Lakeland, what we've been talking about here. Great presentation so far, and let's get right into the questions here. The first question here for you, Lakeland, can dementia in itself reduce appetite?
That's a great question. Dementia really affects everyone very differently. So for some, it could decrease their appetite. For some, it may increase their appetite. Sometimes for a person that has dementia or living with dementia, they might forget that they already ate, or as the disease progresses, they might not be able to express their hunger. So again, that routine can be helpful, and sometimes someone with dementia, especially in maybe the mid to later stage, you might try to offer them something and they might not be interested at the moment. But instead of skipping that meal, it's important to approach it again maybe a few minutes later, even a half hour later, because we know that the progression of dementia, at this point there's no cure and the person is likely to decline. So we want to help them maintain as much muscle mass and as much strength as possible where they are in the disease, because we know, again, that there is a deterioration. So, and some people do ask, my loved one with dementia, all they want to eat is sweets. I can't get them to eat anything else, and that can be a challenge. So some people have the mindset of some calories are better than no calories at all, but in those situations, perhaps talking to the physician about introducing some sort of vitamin or nutrient-rich shake, such as Ensure or a supplement, could help in the nutrition for that individual. But a great question, and I wish I could give you a definite answer, but it really depends on the individual and how the dementia is affecting them.
Okay, thank you. Lakeland, next question, a very important one. Most seniors have a budget of about $16 a month with food stamps. What tips can we give them to buy and use healthy food?
That is a great question. And I did mention earlier how limited incomes is a true reality for so many older adults. And that's an interesting statistic to know, that about $16 a month is provided for food stamp for an older adult. So when you're thinking about the various nutrients, a lot of times frozen or canned vegetables can be at a lower cost, especially if they go on sale. So older adults can check their the daily or the weekly specials for the grocery store or the discounts, and those fresh or so the frozen and canned vegetables can also last longer. So if the older adult doesn't eat them, they don't go to waste. So and frozen vegetables are actually usually frozen soon after they're picked, so sometimes they can be really nutrient rich. And then also some of those staples that can be purchased at a discount. Again, if they're watching the ads to see when items are on sale and purchasing those, and possibly even freezing some if they can purchase them in a larger amount. But that's a great question, and seeing if the store offers some sort of discount for senior citizens, and seeing if the food stamps still apply for those days, then they could get a little more grocery for their dollar on those specific days. But that is a good question. Thank you so much for asking.
Okay, Lakeland, and what about folks who are living in assisted living facilities, whatever that may be? They might not have that much control over their diet, what they can and can't eat. What about folks in that situation?
That is a good question. A lot of assisted livings are moving towards more of a person-centered care approach in their dining facilities, where they're offering more of an a la carte option. So again, that's hard to control. As a family caregiver, you would want to communicate any sort of dietary restriction, especially for those living, in an assisted living setting. But when it comes to the nutrition, if there is a set menu, again, it will look different for everyone, but encourage the older adult to always choose the healthier option if possible. So instead of having French fries or potatoes for their side, perhaps they could ask for an alternative of a salad or a vegetable or fruit, making sure that they're taking in those. And if the person, again, has those dietary restrictions, such as low sodium, or if they're diabetic, communicating that. A lot of assisted livings, at least the ones that I've worked with, do have alternate food options for people with those specific dietary concerns. So would be important to talk with the dietary staff, and if there is a more person-centered approach, an a la carte kind of menu-style approach in the assisted living, it can be tempting for the older adult to want to get French fries with every meal, or a dessert with every meal. But perhaps talking with the older adult about maybe choosing dessert a couple times a week instead of having it every single day. Or, everyone, I think, everything in moderation, isn't that what they say? So maybe splurging and having French fries just one time a week or 2 times a week. Little steps. We know, again, that older adults can be creatures of habit. We all are as humans. So making those small steps, those baby steps in moving towards a more healthy diet or more nutrient-rich diet can really go a long way.
Okay, well, Lakeland, unfortunately, we have reached the end of our hour here, and we're just about out of time, but I want to thank you for a great presentation and for being here today. Thank you so much.
Thank you. Have a great day, everyone.